Fibroids are actually smooth muscle tumors of the uterus. It is also called a myoma. It is a slow-growing tumor and it is benign, which means that it is not cancerous. However, there is a chance for it to become cancerous, and the chance is actually less than 1%. If the tumor becomes cancerous, it is called a leiomyosarcoma. The fibroids can grow in various parts of the uterus. If it grows in a muscle of the uterus, it is called an intramural fibroid. If it grows inside the endometrium of the uterus, it is called a submucosal fibroid. And if it grows on the surface of the uterus, it is called a subserosal fibroid. And it can also grow on the cervix, it can grow in the broad ligament. So there are many areas in which the fibroids can grow. Fibroids are actually a very common condition that we see in our gynecological practice. About 20 to 40% of women will have fibroids in their lifetime. The fibroids can either occur as a single tumor or it can occur as multiple tumors in the uterus. The etiology or the cause of fibroid is unknown. However, there is a family link or a genetic history to the fibroids. Having said about the family history, there is a higher chance for a woman to have fibroids if her mother has fibroids or if her sister has fibroids. The growth of the fibroid is actually stimulated by two hormones, the estrogens and the progesterones. So therefore, they usually grow during the reproductive age of the women. When they menopause, the fibroids will shrink. And if fibroids actually are seen to increase in size after menopause, we have to suspect that it could be a malignant fibroid, which is a leiomyosarcoma. There are certain ethnic groups which has increased risk of fibroids, in particularly the Africans. The symptoms of the fibroids are related to the size, to the whether it is single or it is multiple, and it is also related to the site or the location in which the fibroids are found. But majority of all fibroids are asymptomatic, and these fibroids are usually small and they are present in positions which are not in the submucosal area, and so therefore they do not cause symptoms at all. Generally, fibroids which are present in the submucosal area or actually in the endometrium, patients usually present with very heavy menses. And patient can give a history of passage of large pieces of clots, and sometimes they may have to change pads every hour, and sometimes they can sit in the toilet passing out blood clots. And these are usually quite suspicious of the submucosal fibroids. Other fibroids like subserosal fibroids usually do not cause symptoms unless they become very big, and in which case the patient will present with abdominal masses. And if big fibroid will also cause some bloatedness, and the patient could actually feel that the abdomen has increased in size, or it could be actually detected by an examination. Essentially, fibroids cause abnormal menses, whether it is heavy or it can also be prolonged. Big fibroids can also cause pressure symptoms, especially when they press onto the bladder. So they causes urinary problems that patients may have to pass urine more often. They have a sense of urgency if they press onto the area which is very sensitive, which is the trigone area, and so therefore the patient may have a sensation to pass urine very often. And if the fibroids are very big, it may even obstruct, and the patients can present with urinary obstruction. Fibroids per se do not cause infertility unless the fibroids are actually causing obstruction to the fallopian tube, in which case, of course, it would cause to prevent the sperm from swimming up into the fallopian tube and cause fertilization. But however, fibroids in the endometrium may affect implantation of the embryos, and so it may not allow the pregnancy to come so easily. Fibroids per se do not affect pregnancy in the sense that it does not harm the baby at all. Majority of the fibroids that we see in pregnancies are small, and so therefore they do not really cause problems. However, there are some fibroids which may be big, and they become even bigger as the pregnancy advances. And if they become too big, they can degenerate and cause pain, and also cause some uterine contractions. And this is not good, especially if the pregnancy is not due for delivery. So we have to be mindful of that. The other factor that the fibroids can affect, I wouldn't say pregnancy, but delivery, is that it may cause the uterus not to contract well after the delivery of the baby. And if the uterus does not contract well, there is a risk of massive bleeding. So we, as an obstetrician, we have to also be mindful of that in such cases, so that we can anticipate this problem and prevent it accordingly. The majority of fibroids do not need to be treated because they are asymptomatic. That means they do not present with symptoms. These fibroids are usually small, and they could be discovered during examination by ultrasound scan. Maybe it's just an incidental finding. But if the patient has symptoms, I think this fibroids needs to be treated. The treatment of the fibroids actually depends very much on the age of the patient, whether the patient desires fertility, whether the fibroid is single or this is multiple, and also we have to take into consideration the patient's choice, which is also very important. If the fibroids are present in the cavity of the uterus, which is the endometrial cavity, we can actually pass the scope from the vagina through the cervix into the endometrial cavity, and the fibroids can be resected. There is hardly any scar, and it can be done as a day surgery, and it is a relatively safe procedure. Besides hysteroscopy, myomectomies can be either done through the laparoscope or by an open method. In a laparoscopic myomectomy, the advantage is that it is a minimally invasive surgery. It is made through a small little incision in the abdomen, and the patient's recovery is very well. The fibroids are usually more or less, we can visualize it through the scope, and we can actually remove the fibroids, and the fibroids are then cut into small pieces with a morcellator, and then they are then removed, and then the uterus is then stitched up. However, not all fibroids can be removed via the laparoscopic method. There are occasions where we have to proceed to an open method, which is called a laparotomy. A laparotomy is a procedure where we make an incision in the lower part of the abdomen, and the fibroids are then removed via this incision. The advantage of this method is that we could actually feel for fibroids which are buried deep in the muscle of the uterus, and almost all, and in fact all the fibroids can be removed via this method. Because it is an open surgery, this surgery cannot be done as a day surgery. The patient will usually stay in the hospital for about 3 days or sometimes even 4 days, depending on the patient's recovery. But usually the recovery is good. Now, upon removal of the fibroids, all these fibroids will be sent for an examination called histology or pathological examination. And the confirmation of the fibroids is actually by the pathologist. Yes, there are actually methods of non-surgical methods of actually managing the fibroids. Like I said, if the fibroids are small, all we need to do is actually to do serial ultrasound to make sure that the fibroids do not increase in size. And if they do increase in size or significantly, then surgery may be instituted. Some patients do not want surgery. They may have a bit of slightly heavier menses, but not excessive. But we can treat them with maybe some cyclocarpron, or we can treat them with even oral contraceptive pills. And if the patient is agreeable, we can even put in a Mirena. But we must bear in mind that these methods do not remove the fibroids. They're mainly treating the symptoms. There is an injection called GnRH agonist, which we can use. These GnRH agonists mainly cause the patient to go into a pseudomenopausal state. So with a pseudomenopausal state, there will be very low estrogens, and because the estrogens level is low, the fibroids will shrink. This is only a temporary method because we cannot keep on giving the patients GnRH agonists forever. We use this method to actually to shrink the size of very big fibroids, hopefully by 50%, so that we can remove the fibroids easily, and which means that the patients will have less risk of bleeding and a smaller incision.